Ma'am, good morning.
Good morning, Shashi.
I think we can
Yeah,
start.
one more minute is there. We'll just start.
Yes.
One more minute is there. Okay, I'll be starting now. A very good morning, everyone. Welcome back for the second day's first aid awareness program. And I'm sure you all know what are you going to learn today. Today we'll be discussing about fainting, heat stroke, chest pain, allergic reactions, and asthma. And I welcome Dr. Jayanth once again. And I hope you all remember the instructions that I have given to you yesterday. I have given you some instructions. I'll just repeat the instructions. First is tomorrow, that is the last day of the awareness program. We'll be having a test also, a small Google form test where whatever you have learned, you have to answer and you'll be given certificates. Okay? And the chat box will be disabled. For now, till the time Dr. Jayanth speaks, we'll be disabling the chat box. Once Dr. Jayanth finishes, we'll be enabling the chat box and then we'll start taking questions. And yesterday what I realized is same question is being repeated time and again. Please do not do that. Once you put the question, do not send the question again. Okay, only once, because there'll be so many messages like that, then we'll not be able to answer all the questions. Okay, and then if you have any queries, like as I mentioned, when once we enable the chat box, that time you need to post your questions. And please do not post anything that is not concerning the subject, whatever we are learning today. Okay, I hope I'm clear. And now I request Dr. Jayanth to take over.
Good morning, ma'am. Good
Good
morning.
morning, Dr. Jayanth.
Good morning. So, welcome to day 2 program of first aid awareness. Hope everyone is fine. Okay, today we are going to speak on these topics. First one is fainting, heat stroke, followed by chest pain in children, then allergies and asthma. Okay, what about fainting? It is a sudden loss of consciousness due to decreased blood supply to the brain. It is more common in the teenagers, and most of the times, nothing to worry, it is not serious. And most of the people usually recover within a minute. So what happens? What is triggering fainting? The first and most important one is dehydration. Prolonged exposure to heat or not drinking enough water will lead to less blood volume and therefore less blood supply to the brain. Then prolonged standing for long at one place, not moving from that place, that also leads to pooling of blood in your lower limbs, that is in your legs, and therefore decreased blood supply to the brain. This will also lead to fainting. Then there is a something of hyperventilating, that is breathing too fast due to anxiety or fear. This leads to changes in the blood supply to the brain, which will also lead to fainting. Then some people have very strong emotions when they have pain or look at some blood spilling. uh, Then something which they might find it shocking or surprising or scary, they faint. And in toddlers, we see holding spells, which will also sometimes lead to fainting. But these are all not serious. There are certain other reasons which are more serious concerns, and we have to particularly treat them medically. These are one is anemia. Anemia is less hemoglobin in the blood, which will decrease oxygen supply to the brain. Then eating disorders. You don't eat properly, you, your nutrition, you you will faint. Then other reasons are diabetes, migraine, if some child has a heart issue, sometimes hormonal imbalances, and in a rare case, alcohol or drug abuse, particularly in teenagers. Then we have warning signs. Some Most of the people, they experience some warning signs before fainting. They feel little lightheadedness or dizziness, nausea, that is feeling like vomiting. Then sometimes they may feel some warmth feeling or sudden cold feeling, and they may sweat profusely all of a sudden. Vision may become blurred. There's some ringing sensation in the ears, pale look, and faster heartbeat. These all are warning signs before fainting. So, what to do when a child faints or about to faint? Should try to catch the child while falling and ease them to the floor so that they don't get hurt. Then, after easing them to the floor, raise the legs for about 10 minutes. This will increase the blood supply to the brain. If the child has some food material in the mouth, lay them to the one side. So, this will prevent choking on food. So usually most of the children, they become all right in 10 to 15 minutes. If the child doesn't become all right in 10 to 15 minutes, then that is a serious concern. So uh, when should you go to the hospital? As I said, when child is not waking up in 10 to 15 minutes, then while they have fallen down, they have received some major injuries, hmm, or they have fainted after taking a medication or bit by an insect, or eating some food which they are allergic to, or while playing or exercise. These are serious concerns. They should be taken to the hospital. And after falling, the child, if they are having any trouble breathing, talking, or moving, they should also be taken to the hospital. Then, how to prevent fainting? Yes, fainting can be prevented in most of the cases. The basic rule is to stay hydrated, that is, drink well, keep yourself hydrated, then eat well. And when you're standing for a long time, keep flexing your muscles. That will keep your blood circulation on the go. Avoid unnecessary exposure to the heat. Don't stand for long time in the heat. Don't play for long time in the heat. And children should be educated about early signs of fainting if these fainting episodes are become recurrent, so that the child learns to prevent injury. Then this moving to our next topic, that is heat stress. So any prolonged exposure or physical exertion in the high temperatures will cause overheating of the body. This overheating will lead to illness. So there are two forms. We can divide heat stress into two forms: mild and severe form. Mild form is called heat exhaustion, and severe form is called heat stroke. So let's see the differences between heat exhaustion and heat stroke. When a child experiences heat exhaustion, they are usually exposed for a little less time to the heat compared to heat stroke. The second one is the temperature difference is there. Usually 103 degrees to 104 degrees is what we see in heat exhaustion, while heat stroke hits the temperature is more than 104. In heat exhaustion, the child will sweat excessively, whereas there is no sweating in heat stroke. When you check the pulse is rapid and weak in heat exhaustion, whereas it is rapid and strong in heat stroke. In both the cases, the child may experience nausea or vomiting. Then in heat exhaustion, the child has cold, pale, clammy skin. Whereas in heat stroke, the skin is red, hot, and dry. Child also experiences muscle cramps in heat exhaustion, and in heat stroke, child may experience muscle cramps along with more severe throbbing headache, and child may also lose consciousness. Okay, how are we going to manage heat exhaustion? Whenever you find the child is experiencing heat exhaustion, immediately bring the child to a cool, shaded place. Then give them cool water along with salt to drink, because while sweating you lose lot of salt along with water. So give some salt water to drink, and you can as well use ORS liquid available in the market. Then apply cold wet cloth over all over the skin. Then if child is experiencing muscle cramps, gently stretch and massage the muscles. That will relieve the pain. Then our target temperature is less than 100 degrees Fahrenheit. Then how are we going to manage heat stroke? Heat stroke considered as a medical emergency. The child should be going to the hospital, but before going to the hospital, you can do few things at home. The child usually shows temperature of more than 104 degree Fahrenheit, and as we did for heat exhaustion, the same steps will be repeated. Bring the child to the cool shaded place immediately, but here you have to go for rapid cooling. So make the child sit in the cool water, either in the tub or in a bucket if the child is small, or otherwise if those two things are not there, pour cool water over the body. So if the child is alert, the child is speaking, only then give oral liquids. Otherwise, do not give oral liquids and immediately take to the hospital. So can we prevent heat stress? Yes, we can prevent. The sutra is that you should not go out during the hot time. That is, you should play during the cooler times of the day, that is early morning or in the little late evening. Then when you're playing outside, even during the summers in cool times also, you should take frequent breaks. You should keep drinking water, use sunscreen, and then wear clothes which are suitable, like loose fitting, light colored, and lightweight cotton clothes. Okay, then moving to the next topic, chest pain in children. Chest pain is almost experienced by all children at some point of their life. So chest pain can occur because of any structure in the chest, either from the skin, bones, chest wall muscles, joints between the bones, then internal organs such as lung, esophagus, and rarely heart. Heart conditions in children usually doesn't give chest pain. So sometimes, rarely, chest pain can be a manifestation of serious underlying disease, such as lung infection, that can cause chest pain, which is serious. So let's look at the causes of chest pain. Any kind of trauma, injury to the chest, leading to skin injury, rib fractures, muscle tears, lung injury, etc. These all cause pain. Then costochondritis. Costochondritis is inflammation of the joints. The joints become swollen because of some viral infection or some bacterial cause. Then because of some children, because of stress and anxiety also, they experience chest pain. Then there is something called precordial catch syndrome. Precordial means chest in front, is called precordial. So there is a sudden sharp shooting pain in the chest or in the back with inspiration. What is inspiration? When you're breathing in air, it is called inspiration. So that sudden sharp pain while inspiration is called a precordial catch. And usually this lasts for several minutes, but this is not a serious condition. Nothing to worry about it. Then there is other condition called acid reflux. Poor eating habits. This will lead to the acid in the stomach to push out through the mouth. So while traveling through the esophagus, that is the food pipe, it causes inflammation in the esophagus. That is called acid reflux. Then rarely in heart problems, lung infection, or in asthmatic cases, child will complain of asthma, chest pain. So what should we do? So most of the times, this chest pain is self-limiting, thankfully, and is less serious. So the first thing we do is reassure the child that it's going to be okay. Then ask them to give adequate rest, give healthy diet to prevent acid refluxes. Then you should avoid excess activity which is going to lead to a trauma. Then in some children who experience stress or anxiety because of their schoolwork or peer group or family issues, they should be given emotional support that will relieve their chest pain. And if the chest pain is recurrent and frequently bothering, then they should consult the doctor. Let's move to the next topic, allergies. Allergies are very commonly seen. Almost about 6% of population experience some or the other kind of allergies. So what is an allergy? Allergy is an abnormal immune system response. We all have immunity. So whenever there is some infection or some foreign body touching our body, then we have some immune response to it. For most of the people, there are many harmful things which come and go, for which people don't develop any kind of immunity. But when some people develop abnormal immune response to this commonly harmless substances, that is called an allergy. So those substances are called allergens. So it is mostly airborne, such as dust, pollen, mold, or sometimes it is food. These are food items. Sometimes you are allergic to medicines or some insect bite. What organs can be affected with this? Eyes, nose, throat, skin, lungs, and gastrointestinal tract. That is your gut. So you can also see that in some cases, in some people, the allergies are seasonal. It occurs only during particular season, and some people they are allergic to more than one substance. And it is also seen that many people who have allergies, the other family member also are more likely to have allergies because usually this runs in the family. And there is something called severe form of allergy, which is called anaphylaxis. We'll discuss about this. So, allergic reactions, the roots of allergens entering our body or touching our body is skin contact, like some plants, where when we touch them, our skin becomes allergic and we get skin rashes or hives. Then some animal scratches, particularly cats. When pollen touches skin, latex, gloves, these are all materials which can cause contact allergy. Then injection form is through insect bites. Particularly when a bee stings, you are supposed to contact the doctor for getting a medicine which can reduce the skin rash. Then coming to ingestion mode. What is ingestion? Something consumed through our mouth is called ingestion. So there are some medications which can cause allergy, and there are some foods like nuts, shellfish, soy, cow milk. These are all foods. Some people are even allergic to wheat. Some people are allergic to gluten. These are all food materials which can cause allergy. Then airborne mode allergens are pollen, dust, mold, or animals which shed dander. Okay, what are signs and symptoms of allergies? In allergic rhinitis, the allergy which attacks your nose is called allergic rhinitis. This is usually caused by airborne allergens. This develops at the age of 10. It peaks during the age when you are 20, and it usually resolves between 40 to 60. That means technically you are living this allergy almost for your lifetime. Then symptoms are there's a lot of sneezing, nose is itchy and stuffy, there is throat irritation and cough. Then moving to allergic conjunctivitis, it affects the eyes. The eyes are itchy, watery, and red. Then allergy to food, medicines, and insect bite. Symptoms can range from as mild as skin rash to as severe as breathlessness, pain abdomen, or drug rash syndromes. What are drug rash syndromes? Drug rash syndrome is syndrome where the skin shows extensive skin rash, which can extend to the mucosal surface, that is inside of the mouth, nose, or eyes, and can also affect the internal organs such as heart, lungs, kidneys. So this is a severe form of drug allergy. So coming to anaphylaxis, this is a very severe form of allergic reaction which can potentially be a life-threatening situation. So children who have recurrent allergies and who get severe allergic reactions, they can develop this kind of anaphylactic reaction anytime. So how it happens? Most of the times when there is a contact allergen, anaphylaxis happens very rapidly within few seconds. There is extensive rash, extensive swelling all over the body. It can affect any place and it can be life threatening. Sometime where the food substance is an allergen, the reaction can manifest later, around 1 to 2 hours later. Okay, this is how it looks. There is a swelling of lips, swelling of tongue, swelling of the throat, weak rapid pulse. You will feel dizzy, sometimes difficulty in breathing, and there's wheezing sound like a whistle when you're breathing out air. Then severe stomach pain. These are all symptoms of anaphylaxis. So, how are we going to identify allergic reactions? Whenever there is a skin rash, it is fairly easy to identify that this is an allergy. But some people who have cold-like symptoms, recurrent sneezing, coughing, throat irritation, and if it is lasting more than a week, it could be an allergy. You should consult your doctor to confirm it. And people who have recurrent dry eyes and dry nose, that is also a sign of allergy. So they are at high risk of contracting allergies frequently. Then people who are getting symptoms seasonally, that is every winter you get allergy. That is due to allergy again. Then how are we going to manage allergies? Allergies are usually hard to cure, but symptoms can be managed. So some general measures are here. First and foremost important thing is avoid the allergens. Educate the child about their allergies so that they can prevent the allergen, and at the same time they can identify their own symptoms early so that they can seek medical advice as early as possible to decrease the symptoms and suffering. And caregivers should be informed about the condition and the treatment going on for the child for a particular kind of allergy, and always be in contact with your doctor regularly. That will give healthy lifestyle. So how are we going to manage airborne allergies? So how are we going to control allergens which are in the air? So first thing, if you have pets, keep pets out of your child's room. Then clean the room when the child is not around. Don't use heavy clothing such as carpets, rugs, heavy curtains, thick pillow covers. These all can catch the airborne allergens, and later the child will get affected. Change the bed sheets and pillow covers frequently. Sometimes some kids it will require to be changed every day. The children should change their clothes after playing outdoors so that they should not carry outside allergens. Some kids who have pollen allergies, the window should be closed during the pollen season. And The child should not be allowed to mow the lawn because the pollen will rise in the air. Then there are molds, that is fungus, which grows in the dark and damp areas. If a child is allergic to these molds, the child should be kept away from those areas and surroundings should be kept clean and dry so that molds don't grow. So how are we going to manage food allergies? So when you notice that your child is allergic to certain food, avoid those foods. Unfortunately, there are many other foods which will have small quantities of the allergic food, which you may not be knowing or no labels will be showing it, and the child may end up consuming those foods. So, some care should be taken. As far as possible, do not eat outside food. Then, always make a habit to read the labels on the packaged food. All the caregivers and the friends of the child should be informed about the kind of food allergy the child has so that they don't offer such foods, and they will know when the child is facing some allergic reaction, they will know that the child has consumed such kind of food. So, child should be educated to prevent these food allergies. Then coming to our last topic of this day, asthma in children. What is an asthma? It is a sudden or slow narrowing, or otherwise medical it's called acute or chronic. Now narrowing of the airways. We have an airway to breathe, trachea, then bronchi. So this narrowing occurs at the level of bronchi. So when certain triggering agents they come and contact the airway, our airway gets irritated and it becomes narrowed. This will lead to symptoms. That's called an asthma. So what can asthma do to us? Because we feel breathless, we will be unable to perform our daily activities. We will not be able to play sports, go to school, or sleep properly. So we have to learn how to live with it, how to keep it under control, to have a better quality of life. So when you look at these pictures, on the left side you can see that the bronchiole is normal. This is how usually it looks. Our airway internally it looks like this. But when a child has or someone has an asthmatic attack, the bronchiole opening, the passage of the bronchiole becomes narrow because of the inflammation or the reaction. So let's look at what actually cause these asthmatic attacks. Most cases run in families, as do the allergies. Asthma is nothing but an extension of allergy. So it has triggering agents same as allergies such as dust mites, pet dander, pollen, mold, air pollutants such as vehicular pollutants, cigarette smoke. Some people they are sensitive to cold temperatures. Some people when they get a viral infection such as common cold, it will become an asthma as they are allergic to viral infection. Then some people some medicines will trigger the asthmatic attack, and exercise out of our limits sometime can also trigger asthmatic attack. As you become more breathless during exercise, more and more breathless, you may experience asthmatic attack. So symptoms and signs of asthma: the child will be frequently coughing, that worsens when the child is exposed to an allergen or due to an activity. Then the child will feel breathless, that is shortness of breath. Then you can listen to the whistling or wheezing sound when breathing out. Then the child may experience chest congestion or complain of chest tightness. Child will have poor sleep, and the child will be most of the times tired. And due to all these things, the child will be unable to perform activities like other children. What are we going to do about it? So first thing, as in the topic allergy which we have discussed, we have to avoid the triggering agents. And the child should be educated how to avoid these triggering agents and how to identify their symptoms and when to come to their parents or teachers explaining about their symptoms. So all the caregivers should be informed about this condition, their medication, and any kind of change in the medication, and when to take those medication. This is called create an asthma plan. So always use prescribed medication regularly. Do not avoid medication. Do not skip the medicines, and keep your doctor in touch regularly. Don't allow smoking around the child. Encourage child to be active, because most of the children who have an asthma, they will gain weight, and this will further complicate and increase the number of asthmatic attacks. And children who have acid reflux, even obesity increases acid reflux condition. So try to give healthy food and decrease the acid reflux symptoms. This will decrease the number of asthmatic attacks. So when are you supposed to see a doctor? When the child is persistently coughing, particularly when child performs some activity and child becomes breathless at that time. That is the time the child should actually see a doctor. And we are able to listen to the wheezing sound when child is breathing out air. That is another time when we have to see a doctor. Child is either feeling breathless or rapidly breathing, complaining of chest tightness, and child is having recurrent chest infections. They should see a doctor immediately. This ends our day 2 session. Thank you very much. Thank you, ma'am.
Thank you, Dr. Jayanth. Can we take some questions, please?
Sure.
Children, like if you want parents, you also can post your questions in the chat box. Please do not repeat the same question. If you want, you can post your questions in the chat box so that Dr. Jayanth will answer your questions. So even frequent exercising, like when a person is standing for a long time
Yeah.
and exercising, even that time, like I've seen people faint. So that is basically because of.
Yeah, ma'am. That is because they might have been dehydrated and the blood volume will be low in them. So, during that time, if they are trying to perform some activity, the blood supply to the brain goes down rapidly and they can
Okay.
suddenly fall.
Okay. So that the best way is to, like, how do they?
Keep yourself hydrated.
Okay. And someone is asking, what are symptoms of asthma?
Asthma, first thing is child will have a repeated coughing, then there you may hear some sounds like a whistle coming out of your chest when you're breathing out. And some if the severe form, then child may even experience breathlessness. These are the main symptoms.
And how to prevent B12? Someone is asking how to prevent B12.
B12.
Yeah, someone has given a question how to prevent B12.
B12 is a vitamin, no?
Yeah, B12 is a vitamin. I know. Someone wants to know what is acid reflux.
Acid reflux is when we in the stomach we have some acid production. Hydrochloric acid is produced in the stomach. It helps in digesting our food. So there is a sphincter between the stomach and our food pipe, that is esophagus. When this sphincter is not functioning properly, particularly in those people who are obese, this sphincter becomes weak, and this acid, instead of staying in the stomach, tries to come out of the stomach into the esophagus. And sometimes you may have experienced some bitter taste in your mouth when you are having some burps.
Okay.
That is nothing but the hydrochloric acid. So this is
So, it,
called acid reflux.
so
Sir,
basically
excuse
it
me.
is acidity, what we call it.
Yeah, acidity.
Okay.
Yeah, one more question from the child, sir. Like, headache is more due to the rainfall or over usage of electronic gadgets?
Hmm. Pardon, can you please repeat the question?
No. What the child is asking, the headache is more due to the rainfall, growing in rainfall, or due to the over usage of electronic gadgets?
Headache.
Yes, yes, headache.
Headache has many reasons. The prolonged viewing at the screen without moving our eyes can lead to headache. And I think they are asking about whether getting wet, your
In
head
the
wet,
rain, yeah.
that also can lead to headache. If you don't dry your head properly and fast, that can also lead, because you might be sensitive to cold.
So what is the difference between migraine and headache? Like
Mm. Headache has many reasons and many types. Migraine is one type of headache. The reason for migraine is unknown. Some people just experience headache on one side and it doesn't go away easily. And the regular medications, regular painkillers won't help. It is considered mostly because of some chemical imbalance in the brain. So we try to correct that chemical imbalance through giving medicines. In some cases, it helps. And the other headaches, because of sinuses filling up, we have some bony air pockets in our head around the nose. So when these sinuses fill up with mucus, that is out when we get infected, when we have upper respiratory tract infection, our sinuses get filled. So that time also we can experience headache. The other one is stress headache, or otherwise called tension headache. So this headache is like a band, like if you tie a band around the head and pull it tightly, you experience some pain. The headache is similar to that. And there is another headache usually occurs in the posterior part of your brain, of the head. That is because of poor vision. If you have any posterior headache, immediately you should consult your ophthalmologist. You might be having eye error, vision error.
someone is asking how to treat chest pain.
Chest pain, particularly in kids, is a self-limiting thing. The only thing what you can do at home is give them adequate rest and reassure them it will come down. And most of the kids, 10 to 15 minutes usually it disappears. And if it is not disappearing, it is becoming a recurrent thing, you should always consult your doctor because they need evaluation.
And one more question, sir. Like, what is the main reason for uh, children will get affected with pneumonia? So, what are the how do we they need to take care of that?
So pneumonia is nothing but infection of the lungs. As the child airway is small compared to adults, the allergens and the infective materials such as bacteria or virus, they can travel very fast to the lungs. And child, because they are less mature about how to take care about themselves, they are more prone and more exposed to infections, particularly the way they play, the way they soil their clothes or soil their hands. This will all lead to expose them to the infections. So once there is an infection in the lung, they have to consult a doctor for proper diagnosis and proper treatment. If the infection is only limited up to the throat, we call it upper respiratory tract infection. That can be treated on outpatient basis. Whereas when it is a lung infection, some cases can be treated on outpatient basis, but most of the cases need admission in the hospital.
One parent want to know if asthma, can it be hereditary? Does
Yes,
asthma come for children
asthma
if
and
parents have?
allergies in most of the cases are hereditary. Some of the other family member might be having it, or there might be a generation skip. Like grandparents might be having allergy, parents may not be having, but grandchildren will be experiencing that allergy. Most of the cases, but in some cases, it is totally unrelated to any family member.
Okay. One child writes that his brother has cow milk allergy and is just 3 years old.
Yeah.
What should we do? What can be done?
If someone has cow milk allergy, usually about 6 to 7% of kids they experience this cow milk allergy. So if someone has a cow milk allergy, they have to avoid that food. There are other options. Buffalo milk is there, soy milk is there. So there are other options. You can explore that.
Sir, one question from a parent.
Mm.
So, what is parent asking? While child is eating, he always complains about the chest pain. What might be the reason for that while eating?
Child might be probably having esophagitis. So esophagitis is because of the acid reflux, as we discussed earlier. The acid in the stomach is coming out into the esophagus, and only our stomach is designed to tolerate acid. Rest of our gut is not designed to tolerate acid. So if acid comes into contact with the esophageal wall inside, then the wall gets damaged. So that is called esophagitis. So there are multiple raw surfaces. So when a child is trying to eat food, the food comes into contact with these raw surfaces and the child will experience pain. So probably the child has acid reflux that has to be corrected.
And one more question, sir. What is the meaning of heat stress?
Heat stress is a broad term describing any form of injury to the body because of heat. So it can be divided into two: heat exhaustion with a milder symptoms and heat stroke with a major symptoms, more concerning symptoms.
Someone is asking, why should we keep animals out when someone has asthma?
Probably the child or the person who is raising these pets may be allergic to animal dander. Animal dander is nothing but the animal skin. It comes out as a flakes and keeps on shedding because of the fungal infections. Usually we call ourselves having dandruff. So that acts as an allergen, and when that can be spread anywhere in the room, on the bed sheets, towels, everywhere, because it keeps on flying in the air, so it can land anywhere. And if the child breathes in, his symptoms will become severe. So we want the basic idea is to create a room or a space where child is totally free of these allergens.
And
So
what is the main reason for the dark circle under our eyes, sir? Like
dark
some.
circular under eyes, mainly it is because of the stress, prolonged watching the screen, blue screen, and less sleep. This will give dark circles.
And someone is writing that I have asthma for 1 year, but till now it is not clear. What should I do?
No, if is the child consulting a doctor for that?
Nihant Sai, are you going to the doctor? Is it parent or the child who had given this question?
So that's what, as I told ma'am, if the child is experiencing recurrent episodes of asthmatic attacks,
Hmm.
they should consult an asthma specialist or allergist so that they get a better treatment and better options. And we have to know whether the child is using any inhalers which has some bronchodilator or some steroids, and how is the weight of the child, because the child is overweight and experience recurrent symptom, probably reducing the child weight by increasing the activity might help him.
And when is the pollen season? Generally, like when children.
Now, Poland, it is there throughout the year, ma'am. Particularly in our country, tropical countries, pollen is there throughout the year, but more in cold seasons, because cold is added to pollen now.
Okay.
So some children are sensitive to some kind of pollen in one season. Some may be sensitive to pollen which is coming in summer. Some might be sensitive to pollen in winter. So in those cases, they have to identify in which season they are getting these allergies, and in that particular season, they have to take care.
And this Congress grass, that grass which has those white flowers,
Yeah,
is it an allergen?
yeah, it is an allergen. No? It is considered as an allergen, and it can cause allergy. But most of the people are not allergic to it,
Okay.
because
But generally, huh,
that is found commonly everywhere.
commonly everywhere. That's why that could be one other reason for.
Yeah, that's an allergen. Man. That goes throughout the year.
Someone is asking, what is anxiety?
Anxiety is a psychological feeling where you're not able to feel secured or safe or balanced. You feel excited about something where the other person may not be feeling excited about it. See, looks at a dog, they're afraid, they feel anxious. Many of the people, they look at the dog, they don't feel anxious, they don't feel afraid of it, because they feel they can handle it.
Suggestion from a parent, long question. Like her daughter age is 12 years. So from 5 years old, they are using, I think, inhaler. It seems to inhaler. So from past 5 months, they are stopped using the inhaler, but instead of that, they are using Montext tablet. It seems
Okay.
Montext tablet. Now they are having some. I think children is they get affected with got affected with some skin allergy. What to do? The parent asked me.
Okay.
Montex tablet. Because of using Montex tablet, they are, I think children got affected with skin allergy.
Mm. Montex may not be the reason for skin allergy. Montex is an already an anti-allergic medicine. So it may not be the reason. Probably the child might be experiencing some other allergy, and this Montex LC may not be enough to treat that allergy. And the child is an asthmatic, right? Previously,
Yes, yes, sir. From 5 years old, I
yeah,
think
has been
they are,
using medicines for that.
yes, inhaler, and they
So,
stopped inhaler. Instead of that, they are using the tablet.
okay. Probably the doctor has asked them to stop it.
I
See, the
think so.
depends from patient to person, it varies. The treatment keeps on changing. So the doctor is the best person, and they know the best how to treat. So this skin allergy may be totally unrelated to this.
Okay.
Someone is asking how to prevent ear fungus.
Ear fungus. See, fungus usually grows in wet and damp, dark areas. Our ear is dark already inside. So if water is added while taking head bath, water is added and you don't clean your ear properly and you don't keep your ear dry, that is a suitable environment for fungus to grow. So just keep your ears dry and clean. That will prevent fungal growth.
And one person is asking, my friend cannot stand for more than 5 minutes. What can be the reason?
It is tough to say, ma'am, why the child is not able to stand for more than 5 minutes. There might be many reasons which has to be evaluated medically. So they have to see a doctor for that.
Okay. And someone is asking, is it safe to use rotoheller during asthma?
If it is prescribed by a doctor, then that is the most suitable medicine. So rotahelers usually they come with mild steroids, so that can be used, but not without the advice of a doctor.
Okay. Any other important question, Shashi?
No, ma'am. I think what's that?
No, but someone gave a question saying that they got hurt in the eye. So he says even now, like I think he got redness in the eye still.
Okay.
So they wanted to know how can it be.
No, if it is not hurting, it is only the color change or a bleeding under the conjunctival membrane. They need not worry; it will settle in few weeks. But if it is hurting, it is paining, then they have to definitely see their ophthalmologist for further evaluation because there might be some internal damage which has to
Okay.
be corrected as soon as possible.
And one person writes, every day I'm having headache on only back of my head. So what should I do to get rid of it?
They should probably consult an ophthalmologist to check their eye vision.
So
And then
basically, this is backside is
the
because of
backside is for vision.
vision. Okay.
And yesterday, one person asked the question about EpiPen.
Hmm.
As I said, tomorrow we will discuss about it. EpiPen is a drug-loaded injectable pen. It might every one shot it delivers about 0.15 mg of epinephrine. In general, we call adrenaline. So that is one drug which can be used in severe allergic reaction, or when we know a child is allergic to something and they will have a severe reaction to it. For example, someone is very allergic to peanut and they accidentally consume it, and, the child has already had severe reactions previously, which has led him to the hospitalization. So that child can take that injection into the thigh, should be given into the fat tissue of the thigh. And other condition where it has definitely helps save a life is in anaphylactic reactions, as it rapidly deteriorates to a life-threatening situation. In that case also, this EpiPen is a lifesaver.
And someone is writing that they get mild pain in between the chest and it is rare. But what can I do? And the pain decreases in 10 to 15 minutes.
They have to just take rest, man, and keep themselves hydrated and eat healthy food.
Okay.
That will decrease the number of episodes of this chest pain, and over a time, once they cross the teenage, usually this pain thing will settle and it will not recur.
Sorry, question from a parent. I am unmuting them. Just please. Ma'am, you can ask question to the Hitansh Spicy. Can you please unmute yourself? Hitansh.
Only if it is parent, then you unmute, Shashi. If it is
Parent,
child, don't do it. Yeah.
parent is there. Actually, they were trying to speak. They are unmute.
Hitansh, ask your parent to unmute and speak, ma'am. Only parents. Children, you can post your questions in the chat box.
Yes, ma'am, you can speak now.
Hello, sir.
Hello, ma'am.
Yeah, 2 months back, my son met with an accident at his elbow, sir. His elbow was wounded. After recovery, he had an hairline fracture on its elbow.
Okay.
After recovery, he had a mark, sir.
Okay, scar on the.
Yeah, scar.
Okay.
If
How old is
he,
he?
9 years, sir.
9 years. Okay.
Yeah. As the days pass, it will go or it will stay like that only, sir.
Most of the scars they fade away, madam.
Okay.
But few scars, if they are too deep.
No, not too deep. Just hairline fracture.
No, fracture is hairline. That is not a concern. In around 6 months to 2 years,
Okay.
even the hairline will not be seen on X-rays.
Okay.
But if the skin injury was deep at the time of fracture or trauma, if it's only epidermal injury, that is at the top layer of the skin, it will heal completely.
Okay, only top layers, sir, not deep.
It will heal, madam. It will.
Yeah, as the days pass, no, when skin expand, it will cover, no, sir.
It will cover in about 2 to 3 years, ma'am. You will not be
Okay.
able to find that scar that obviously.
Okay, sir. Thank you, sir.
Thank you.
Any parent would like to ask a question? Any query? Someone is asking COVID-19 third wave. Will it impact kids? Is it true?
Usually, any viral pandemics, look at even polio also. It keeps on changing the age group it affects, because virus tries to thrive on hosts who are available. So, for example, this COVID-19 has first affected senior population. So now less senior population is available. So virus modified itself and then it has come to now young adults. So now the only kids are spared. So probably it is expected to affect the teenagers more now. So this is how usually the pandemics move. So any more thing?
Yeah, someone is asking, I have chest pain. I can't breathe for a minute. What should I do?
They should just take rest, ma'am, and if possible, if they take a deep inspiration, forceful deep in breathing in air, this chest pain will be relieved. If they are not able to do that, just take rest, lie down, and try to breathe slowly and deeply. That will relieve the chest pain.
Okay.
They'll feel more comfortable.
And someone is asking, they have regular vomiting sensation. How do I stop it and what is the cause?
Okay. If someone is having regular nausea, that is vomiting sensation, then we have to know why they are having that. So further, probably they have to consult their doctor if it is bothering for a long time, because usually this kind of sensation happens once in a while. That is fine, but usually self-limiting and within a half day or a day, it has to resolve. If it is not resolving and this is happening recurrently, we should consider there is something a little more serious issue, and they have to see the doctor for evaluation.
And someone is asking, the moment they wake up in the morning, they have a headache. So what can they do? And
There is one reason. Our Earth is round and we have a North Pole and a South Pole. The best way to sleep, way to place the head, is either in the east or the west. So when someone is placing their head in north or in the south, the iron in our body, iron in our blood, in our red blood cells, it tends to move towards north and south. So our legs and our head get heavy in the morning. So probably they can try changing their position to east or west. Another reason might be that the person is sleeping in in a heavy AC situation where the sinuses are getting filled by morning and they are experiencing the headache. So if these two things can be corrected, most they will be relieved.
Sir, a question from parent. Banareka, you unmute yourself. I think your
there's
father.
one more parent, Shashi, asking to unmute.
Yeah, first Banureka, ma'am. They are asking something. Yeah. Sir, unmute.
Sir, please unmute.
Yes, sir.
Sir, speak, sir.
So morning, sir.
Morning.
సో బాగుండేస్ ఫాదర్ మా అమ్మాయికి ఇక్కడ నెక్ కింద అంతా కొంచెం బ్లాక్ కలర్ గా వస్తున్నది, అది స్కిన్ ఎలర్జీ అంటారా?
పాప ఒబీస్ ఉంది కదండి,
ఏందండి?
అంటే పాప లావుగా ఉందండి?
ఏమన్నారు?
పాప లావుగా ఉందా?
వెయిట్
కొంచెం లావు ఉందండి.
అది వెయిట్ తగ్గుతుందండి. అంటే వెయిట్ పెరిగినప్పుడు ఏమవుతుందంటే మన స్కిన్ కొన్ని చోట్ల స్ట్రెస్ గురవుతుందండి. అందులో నెక్ ఒకటి అన్నమాట.
ఓకే.
సో బ్లాక్ కలర్ ప్యాచెస్ వస్తాయి. అది అలర్జీ కాదు, అది ఓన్లీ వెయిట్ రిలేటెడ్ ఇష్యూస్ అండి. సో వెయిట్ తగ్గితే తగ్గిపోతుంది.
వెయిట్ తగ్గితే
తగ్గిపోతుందండి అది.
ఓకే, థ్యాంక్ యూ సార్. అది ఎలర్జీ అయితే కాదు.
ఎలర్జీ కాదండి, ఎలర్జీ కాదు.
And Sonia and Saptarishi's parent wanted to be unmuted. Shashi, can you unmute? And someone is asking how to improve height.
Height is a genetic issue. It is an hereditary thing. So the only thing what we can do is eat healthy and play well. So that will keep stimulating your growth hormone. More growth hormone will be produced, and have a good sleep in the night, because growth hormone is usually produced and it's at peak in the night at around 3 o'clock. So when the child sleeps properly, growth hormone will also be generated in time. So
And
so they have a better chance of growing.
Someone is asking about this flu vaccination, normal regular flu vaccinations.
Flu vaccine acts on influenza virus. So every year, being a virus, every year it keeps changing its strain. So what we have noted medically, there are 7 strains, and every year this changes. So when you take a flu shot, that will help you for 1 year, and it should be ideally taken at around November. So that is the time when you get a new strain of flu. So at that time, if you take a new strain vaccine, then that will help you for 1 year. And after 1 year, it usually doesn't help you because the strain will be changing.
Shashi, can you unmute Sonia's parent? Sonia and Saptarish, I think. And one child is asking, when I go out to play, I feel dizzy. What can it be?
The child is probably not eating well or not drinking well, madam. And probably is going into the sun. So if he avoids sun and eats well and drinks well, then probably he will not be dizzy.
And this chest pain, even children are saying, I'm having chest pain. What could be the reason?
Most of the children will experience that chest pain at least once, madam. So usually there are no specific reasons. So only thing is, if you keep your stomach healthy, the acid reflux will be prevented. And if they keep themselves hydrated, then probably their anxiety should be less. So if the anxiety is the reason, anxiety or stress is the reason, parents and teachers should help the child emotionally.
Okay. So basically, these are general common questions only, which others are there. One parent wanted, I think, Shashi, are you there? Acha, Akanksha, 1 minute, ma'am, just finding out because I cannot unmute you.
Which parent, ma'am?
Akanksha. Akanksha, one parent is Sonia, Sonia's parent.
Akanksha.
Akanksha, yeah. Because the time is up. It's already 11. We can finish it off early.
Akanksha, can you unmute yourself, ma'am? I've sent you a request.
Please unmute Akanksha.
Okay, ma'am. Hello, ma'am. Hello, sir.
Yeah.
Hello.
Sir, in type 1 children, we can find some sugar levels will be down sometimes as the reading will go down if they are exposed to sunlight and sometimes. So what is the precautions we have to take that time?
I mean, type 1 diabetes, sugars will be falling.
Yeah.
They're not eating in time. So they should keep a timetable and eat accordingly from time to time and keep themselves hydrated well. This will prevent most of the problems.
During prayer times, they will be fainting sometimes. So what we have to do?
No, they can keep a small chocolate in their pocket, and if they are feeling some dizziness, because usually there will be some warning sign, child will be able to know that. If the child is able to know the warning sign, then they have to take a chocolate and then just put it in the mouth and they'll be fine.
If the condition is serious, sir, if she was fainted, what the next thing, what we have to do in the next moment?
Ma'am, the first thing is if child has fainted and that is because of the low sugars.
Yes, yes.
We can give a little sugar water to the mouth by turning the child to one side and putting drop by drop in the mouth.
Will they wake up in the next moment? The condition is.
It depends. It depends. It depends on how low the sugar is. If the sugar is too low, this may not help much. If the sugar is a little low and the child has fainted, usually it helps. Most of the cases it helps. So if even after giving some sugar water drop by drop into the mouth, then they have to be taken to the hospital immediately. But this water, remember not to give the sugar water in regular sleeping position. They have to be turned to the side and put it drop by drop.
Okay, I think. Shashi, could you find Sonia parent?
No, ma'am, I'm unable to find.
Okay, I think then we'll close it. Thank you, Dr. Jayanth,
Thank you all,
for your patience, and thank you for answering all the queries. Thank you very much. And tomorrow, I think we'll be having the question and answer session.
Yeah,
that is Google Form.
After two topics, ma'am, choking and pediatric basic life support.
Okay, fine.
Okay.
Thank you. Thank you so much.
Thank you, ma'am.
Children, thank you for joining, and tomorrow will be the last day. Okay, we'll be meeting tomorrow once again. Thank you.